Good morning. It's very nice to see you all, and I would like to thank my dear Christina Dragomir for the invitation and for the opportunity to be a part of this very interesting conversation. In the current COVID-19 pandemic, it has proven incredibly difficult to facilitate crew changes on ships. This has led to many seafarers remaining on board ships long after the end of the contract, and in many cases for more than a maximum period of 11 months stated in the Maritime Labour Convention 2006. Despite the collaboration of many parties across the industry, this problem is still unresolved, with up to 400,000 seafarers estimated to be trapped on board. To date, only 46 countries recognized and classified seafarers as a key workers. It's simply not enough. And I would like to address here the governments of those countries who is not still recognize the seafarers as a key workers. You have to understand that they work essential to move the goods across the globe, which we really need now with all the lockdown and the traveling restrictions. Our seafarers are moving food, medical supply, and masks and fuel. We really need to help them. The International Labour Organization Committee of Experts has sent a very strong message to the government that they have failed in the duties of care towards seafarers under international law during the COVID-19 pandemic. All governments have to follow international law and urgently recognize seafarers as a key workers with practical impact. This means allowing seafarers to get off in the ports for the medical attention. We have an absolutely terrible stories when the seafarers were sick with difficult, different diseases not linked to the COVID-19, and they will deny the medical help, they will deny disembarkation, and in some cases, the delay will leading to the invalidization. And the seafarers will be not able to continue working on board on ships, and this should never be, and it should never happen again. We all have to be human, we have to be reasonable, but we have to think about the consequences of the decision taken from the person in the port authorities who let or let not the person to be accepted to the local clinic. It means that enabling seafarers to go to the airports to fly home when the contracts are finished. It means the letting replacement crew through a country borders to join those waiting ships without having to battle a mountain of bureaucracy. There are so many stories how the seafarers are traveling to reach their ship. For example, from Kaliningrad, they flying to Moscow. From Moscow, they're taking taxi. Imagine taxi from Moscow to Belarus to Minsk. From Minsk, they sometimes crossing the borders on foot, or they taking another flight. Of course, with the current situation and the pandemic, there is a risk to get infected during the flight. So I really would like to remind again and again, please, when you wear a mask, be sure that the mask is covering your mouth and covering your nose and cheek. When I see the mask like that and the mask like that, I almost want to kill. It's almost a year since the beginning of pandemic, but unfortunately 80% of the population still cannot wear the mask properly. And there is a big problem. So the transportation, as I mentioned, linked to many areas, and airlines may have their own individual requirements for testing prior to boarding on aircraft. So the recruiting companies, or those who is buying the tickets for seafarers, be sure that it's much longer waiting time in the airports if the person needs to take this test. So please don't let one 1 or 2 hours in between the flights, because then it can be difficult. And when the person loses plane, nobody really knows when it will be the next one. As I mentioned before, hundreds of thousands of seafarers has already exceeded or in the process of exceeding the length of their tour of duty on board. And this has a very negative impact on seafarers' psychological and physical well-being. In addition, the extended period on board may have affected the ability to source and renew prescription for long-term medication. So for those who is just going to the vessel, I would like to ask you, if you're taking any medications on the daily basis, like, the blood pressure medications, be sure that you take some extra boxes with you. I always ask him to take for 2 months. Additionally, now most probably 6 to 8 months. It's not taking a lot of place in your luggage, but remember that if you discontinue taking the medications, it will be really dangerous and put at risk your health and your life. If you're running out of the medications while already being on ship, please don't hesitate. You have to call your master or the chief officer, and they will be able to order this medication from ashore. Be sure that you be able most probably to contact your general practitioner, and this doctor will be able to issue a prescription when it will be stated the exact name and the exact dosage of the medication, because the medicine can vary in the different countries. Also, when you're traveling and you carrying the medications with you, it's also very important to have a prescription, because with these restrictions we're facing with COVID-19 pandemic, some countries which were historically very strict with, carrying medications with you, it's more strict now, like, different Arab countries. So not to be in the situation that the medication will be revoked and you will stay without the, required medicine. Please ask your doctor to issue a very simple prescription and carry it with you. The same I would like to mention concerning glasses. Take an extra pair with you, because if it will be broken, it's hard to order them now. If you're wearing lenses, take some extra lenses and some extra liquid to wash these lenses. It's quite important. One of the most important person on board after the master, most probably it's a cook. And here, especially when the seafarers are trapped on ship for more than 11 months, the cultural difference can be really crucial. Imagine, like, the cook is from Philippines and the crew is from Russia. So the Russians, after a few days, they will really complain that they cannot eat so much rice. Or vice versa, if the cook is Ukrainian and the crew is from India, the Indians will require rice. So we were discussing this again and again, and maybe now it's really the time to make these ideas a reality, kind of hotline or consultation line or the cooking book for the ships. We have the International Medical Guide for ships, so why not to produce International Cooking Guide for the ships, which it will be presenting different, recipes from the different countries, which will satisfy the different cultures on board. Because it's not only eating habits, it can lead to the mental disbalance if continues for quite a long time. I would like to remind you about the necessity to check the vaccination booklet, Because unfortunately with COVID-19, we somehow forget that the other infection diseases exist in this world. So please remember about meningitis, especially in Africa with the meningitis belt, the vaccination about the yellow fever, the vaccination for diphtheria and tetanus. Always to remember that the deck is a place with a high injury risk. Now, some countries are requested changes in the yellow book for the yellow fever vaccination, and this is absolutely unacceptable because the WHO stated very clear that nothing should be changed in this booklet, that all notes are and all the vaccinations done in the past are valid now for the life of person vaccinated. And no stamps, no extra notes, no extra signatures should be there. Please, because the seafarers sometimes traveling to the clinic just to get this note, which is absolutely not necessary. We have to think about the possibility maybe we will have the person sick with COVID-19 on board. Okay, we're trying to make it almost non-possible with the quarantine, with the testing, but it's still possible. I had 2 weeks ago the master of the yacht working for one tourist company en route from Sicily to Turkey. He got a really, acute COVID, and even being a young and healthy gentleman, he ended up in the hospital in Turkey. Greece denied to accept him as a patient to the hospital. He was denied disembarkation, and we were really counting, those few tablets of dexamethasone, aspirin, and a few tablets of antibiotic you find in his medical chest. So should it be a special kit for cases like that, including maybe the rapid test for the rapid diagnosis and some testing for C-reactive protein or procalcitonin, which exists in rapid forms, which will easy very much work of radio medical advice. We have to train our radio medical advice to be able to consult this patient. So there is so many questions, and I would like also to mention that the seafarers have to think about their health themselves as well. They have to train. The minimum physical activities on board is really very important. Who have to take care about this? A master, the chief officer, or a boss? Maybe it will be also kind of coaching from outside. I know that IPF and ISWAN have absolutely perfect programs. So please do this. Also think that not only seafarers are now in the situation when they locked on board, their families at home, sometimes now with this new lockdown having absolutely the same things, and maybe our seafarers in the better position because they're able to see the eternal blue around. So we have to be patient. It's already 1 year. We really don't know how long it will take. The vaccination with different anti-COVID vaccines started in the different countries. We will see the outcome because it's still the third phase of the trial. But let's hope that everything will be working. We are approaching the very nice season. It's a season of festivity. It's Christmas, New Year. This year it will be really very strange. We never faced something like that before. But I would like to wish you all first a very good health. Please stay healthy. Merry Christmas and Happy New Year. Thank you.